Hi, I'm Siobhan Dolan from the Preterm Birth and Healthy Outcomes team.
Hi, I'm Suzanne Tough. I'm an epidemiologist from the Preterm Birth and Healthy Outcomes team. One of the things we have noticed that our families talk about is just the stress of being in the infertility clinic and the stress of trying to manage a very wanted pregnancy when they didn't even know that they were going to be faced with these medical procedures. And it seems that sometimes families don't recognize that these procedures can be invasive and uncomfortable, and I don't know how we can share that better with families either.
Yeah, I think with fertility treatment, if you need to be there, if you need the treatments, then you'll usually be willing to undergo the procedures and bear the financial cost if there is some. But if you don't need to be there, jumping to those steps is I think, the thing that families can do. They can take this preliminary steps and sometimes not need to get into the more invasive procedures. The other thing that comes up sometimes around stress is that a lot of women and families think, well, once I get that next career piece under my belt, or once we get the new house, or once everything's set, then I'll have my kids. But thinking through and balancing the risks of waiting and the risks of sort of getting older, as much as we don't want to admit it, there's some truth to it. That should sort of be factored into the career considerations, the housing considerations, the childcare considerations that a couple needs to think through when planning their families. So the message we want to spread is that there are some challenges to waiting, and so those should be factored into the decision.